Hey guys, knee pain got you sitting on the sidelines? Today I'm covering pain on the outside of the knee. Let me show you how to fix it, get rid of it, and avoid any type of knee surgery. Hey guys, Dr. G, Callus Physical Therapy. Today I'm going to be discussing lateral knee pain, okay? So this is a right knee pain on the outside of the knee, okay? So pain on the outside of the knee, usually after you get an MRI, it'll show that you have some deterioration around the cartilage, the medial meniscus. Now, what I want to bring to your attention is that usually happens over time, right? So over time, if you walk incorrectly or don't have your muscles balanced on the back of the leg, you'll wear away at that cartilage. And then eventually you'll start getting this knee pain, okay? Now, with the leg, right, if you look at the top bone, you can see that if I swing this side to side, there's going to be more movement going this way, okay? So what that leads to, it leads to the knee collapsing inward, okay? When you see that on someone, okay, in real life, it looks like their knees are knocking together. Now, the old way of thinking was that knocked knees is genetic and there's nothing you can do about it, which is obviously false, and there's a bunch that you can do for it, okay? So, the two main muscles that are imbalanced are your hamstrings, your medial and your lateral hamstrings. The hamstrings are going to be on the back of the leg, right? So your lateral hamstring on the side is going to help bend the knee, but it can also put torque on the knee. And then your medial hamstring bends the knee, and it can also put torque on the knee this way. Now you can see if you have two muscle bellies coming down from the top of the hip to the lower leg, there needs to be a balance between left and right in order to create perfect stress across a hinge. So again, it's a hinge joint, and if you have more tightness on one side than the other, it's going to drop your knee in. So in order to fix knock knees and fix that imbalance back there, there's a couple of things that you need to do. I'm going to show you next. So these guys are your knee fixtures. On the amazing website, Amazon, you can get these Tumbl tracks. And this is how you're gonna balance your hamstrings out, okay? So for $10, you balance your hamstrings out and you avoid a $50,000 surgery. How about that, right? And the best thing is you get rid of that knee pain. So, I will warn you, this exercise is a little challenging, but the reward is huge. What you do, you put one of these under each foot, and they're slippery, right? They slide. So what you do next is you bridge your hips, right? Keeping this up and maintained. You're going to slowly slide your legs out. Now as you slide your legs out, you're going to feel the tension in your hamstrings. If you don't have the strength in the hamstrings, this is going to be very difficult for you. So what you do is you only go as far out as you can tolerate. Set the hips down, bend the knees, and repeat, right? Things you don't want to do. You don't want to let the legs flare out, because that's going to strengthen the muscle that's already strong, right? Bring it back in, feet together, lift the hips. Let your feet slide out. You'll feel that tension on the inside of the leg. If you can straighten the leg all the way out before you let your hips down, that's exactly what you want. Lift, straighten out. Just like that. Your repetition scheme is going to be 3 sets of 15, okay? Make sure you take breaks after each 15 repetitions, once daily. Now immediately following this, when you walk, you want to make sure you're using the inner thigh as well as the outer thigh when you walk. What you also want to do is you want to make sure you're pushing off the big toe as you step through and you push off, right? So you're gonna have to make sure your foot's not doing this when you're walking and it's more lined up like this. Try that out. If you have lateral knee pain, it should take about a couple of weeks to eliminate. That's today's video. Thank you for watching. Don't forget to click like and subscribe. Comment below if you want any ideas or anything you want to see on the show. If you've missed any of our previous videos, you can click right here on the top right hand corner. And there's plenty of stuff now that you can look at. I'm sure something that either you've experienced or a family member has experienced can benefit from. That's it for today's show. See you next time.